Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever thought your pee could tell a tale? Well, buckle up because today it's going to spill some beans. Now, before you raise an eyebrow, let me clarify. I'm not talking about your urine morphing into a chatty Cathy, but rather it being a potential messenger of your prostate health. You see, that little walnut-sized gland nestled below the bladder has a big job. And when things go awry, it can impact your bathroom habits. Now, don't get all panicky just yet. It's not about being paranoid, but proactive. It's about understanding that early detection is key and regular checkups, well, they're your best mates in this journey. No, it's not about turning you into a hypochondriac, but about empowering you with knowledge. Because as they say, knowledge is power, and in this case, it could be the power to save your life. So, next time you're in the loo, remember your pee might just be trying to save your life. Ever wondered why sometimes your body feels like it's pulling a prank on you? Well, let me introduce you to prostate cancer, the king of bodily pranks. Now imagine your prostate as a ticking time bomb. What sets it off? Well, it's a tricky combination of lifestyle factors, genetic predisposition, and age. Picture your lifestyle as the fuse. The more you indulge in fatty foods, the shorter it becomes. A diet heavy in red meats and low in fruits and vegetables is like lighting the fuse with a flamethrower. Now, let's talk about genetic predisposition. If your family tree has a history of prostate issues, it's like the bomb was already half-primed when you were born. Finally, age. The older you get, the more likely the bomb is to go off. Specifically, if you're over 50, the countdown has started. So if you're over 50, love a good steak and have some uncles who've had a run-in with this prankster, you might want to keep an eye on your prostate. Now, if your prostate was a novel, it would be one of those mystery thrillers with a plot twist every other page. But unlike a novel, this mystery isn't one you'd want to keep on your bedside table. Picture this. You're a water faucet, right? You're used to a steady flow. But then you start to drip more often, even when you don't mean to. That's frequent urination, our first telltale sign. Now imagine you're a garden hose. When you're turned on, you're supposed to gush out water. But instead, your stream feels more like a dribble. That's a weak urinary flow, another clue in our mystery. Now, what if that hose started leaking at odd hours? Like in the middle of the night? That's nocturia, folks. And then there's the pain in your lower back, hips or thighs. Just like a bad detective novel, it just doesn't add up. So remember, if your faucet starts acting up or your stream feels more like a dribble, it might be time to call in the detectives. Now, you might think there's no joking matter in treatment, but trust me, even the prostate has a sense of humor. Let's dive into the laughable labyrinth of treatment options. First up, we have the surgical approach. Picture a tiny, high-tech robot performing a delicate dance inside your body. It's like a sci-fi movie, except you're the star, and there's no alien invasion. Just a mission to remove that pesky prostate. Then we have radiation therapy, where it's all about zapping those rogue cells with a dose of X-rays. It's like being a superhero, harnessing the power of radiation to fight the villainous cancer cells. Next stop, hormone therapy. This involves turning off the testosterone tap. It's like telling your body, hey, let's take a break from the macho stuff for a while, okay? But beware. Each of these treatments comes with its own set of side effects. It's like a surprise party you didn't ask for, so whether it's a scalpel or a zap of radiation, remember, your prostate might just need a good laugh to get back on track. Well, folks, it's been a wild ride through the land of the prostate, hasn't it? We've navigated the uncomfortable truth, unmasked the sneaky causes, and even decoded the telltale signs. We've laughed our way through the cures, and now we're at the final chuckle. So let's recap. Prostate cancer isn't a laughing matter, but humor can help us face it. Remember the causes from age to genetics and even that sneaky little hormone, testosterone. Don't forget the signs like frequent bathroom trips in the wee hours or struggling with your fire hose. And the cure? A mix of medical treatments, lifestyle changes, and a pinch of laughter. Laughter might not be the best medicine, but it certainly makes the medicine go down easier. And remember, early detection is key. So gentlemen, don't shy away from those regular checkups. Remember, a happy prostate is a healthy prostate. So keep laughing, keep checking, and keep your prostate in check. UMCC, your ultimate medical consultant connector. Kindly like, subscribe and share.